Wellness for Life is brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, and Lakeside Sports and Pain Clinic.
Hi, I'm Dr. Gothenburg from Pelican Rapids. I'm a chiropractor. I've been practicing in Pelican Rapids for beginning my 34th year. And so today I thought about a subject. I'm going to revisit an old subject and see if I can present it a little differently, maybe better. And what I want to talk about is the SI joint. And this refers to the sacroiliac joint. For those of you listening, often people will come and say, well, my hip hurts, and you'll point to an area back here. And I always say, well, your hip is here, but what you're pointing to is the sacroiliac joint. The sacroiliac joint forms the foundation of the spine. And it's a joint that can be sometimes complicated to treat, and for others it's a joint that really never repairs. They're always looking for some form of relief. When I take a step, for example, in this case, lifting my right leg, the ilium assists that by pivoting back on the sacrum, so there's motion in this joint with each and every step. One of the problems that we have when we're treating this joint is that by nature the joint is supported by ligaments. So it is a ligamentous joint. It demands tight ligaments to hold the two bones close together. On the left, I'll demonstrate what that looks like. We just have really a nice tight joint. On the right, we have more play. This will lead to chronic pain, and for you that have had chiropractic care, you'll be returning to the chiropractor looking for some form of relief. So as we go forward with the rest of our little instruction today, I'm going to show you some of the things that we do and what I think are important for correcting this joint. A common approach by most chiropractors is a manipulation where the patient is side-lying. And those of you who have been to chiropractors, you've seen something like this, and the doctor makes a thrust in that direction. That can often help people when they have a more abrupt episode, but when you have a chronic problem where the ligaments are loose, those types of adjustments over and over actually lead to laxity or instability in that joint. So now I'm going to show you a little different approach to treating that joint. One of the approaches that we use is an older technique in chiropractic called SOT, which means sacral occipital technique. And in this technique, we use a series of blocks to change the position or the alignment of the pelvis. So in our example here, I'll place a block high and one lower. So in this case, I'm asking the left side of her pelvis, the ilium, to tip forward, the right side to tip back. So I'm in a sense creating a twist in her low back. With either of the two approaches that I just demonstrated, along with those, we really make really strong recommendations as to how a person sits, how they sleep, what side they should be sleeping on. We try to have people avoid bending at the waist. We ask them to do 1 or 2 simple exercises to apply ice 2 to 3 times a day, and in some instances we recommend a trochanteric support. It's a very narrow belt that's worn very low, below where you would normally wear a belt. And this type of belt, the trochanteric support, actually stabilizes it or reinforces the ligaments. By reinforcing the ligaments, it allows the muscles that sit adjacent or right next to the joint to relax. Usually makes people feel very comfortable. They can ride or sit longer or stand longer without pain. So to end here, if you're the type of person that has a never-changing low back condition where you've been told it's the SI joint and it's really not improving, we welcome you to contact us, and perhaps we can take a slightly different approach to resolving the problem. Thank you.
Thank you for watching Wellness for Life. Brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Ottawa Community Action Partnership, and Lakeside Sports and Pain Clinic.